Hello guys, how you doing? Hope you're having a blessed day. This is Angela with the CNA questions for today. Let's get started. A resident has a severe form of cerebral palsy. Which of the following is the guideline for the nursing assistant to follow when providing care for this resident? The nursing assistant should help the resident move slowly and allow more time for adjusting her body position. A nursing assistant is in the middle of her shift and is behind schedule. She is worried that she will not finish all of the assigned tasks, which include measuring each resident's vital signs. By the end of her shift, which of the following is the best choice that she can make in this situation? The nurse assistant should notify the nurse and explain her concerns. Which of the following is an example of a nurse assistant using personal protective equipment, PPE, donning gloves before handling a urinal? Y'all, this is a trick question right here. Very tricky on the test. For real. Okay. Which of the following infection prevention measures is the best way for a nurse assistant to prevent the spread of disease? Wash hands regularly. Now, that's always the top question. Wash hands regularly. That's always the top question, and the answer is always wash hands regularly. That's very important. And one of the first things you learn when you take a CNA class, it's one of the first things you learn is hand washing. After washing her hands, how should a nursing assistant turn off the faucet at the sink? Use a clean paper towel to turn the water off. So even when y'all do y'all skills tests and take your exam, always after you wash your hands, please turn off with the paper towel. You lose points for that if you don't turn off with a paper towel. You lose points for that. Believe me, you would lose points. For which of the following procedures should gloves always be worn? Emptying the resident's urinary drainage bag. Gloves should always be worn when doing that. It is bedtime and the nurse assistant has just finished helping the resident with oral care. It is now time to work with the resident's roommate. There are no additional set of gloves in the room. Which of the following is the best course of action for the nurse assistant to take? The nurse assistant should notify the nurse that no additional gloves can be found before doing anything else. Always make sure you notify the nurse before doing anything. Okay, one room houses both a healthy resident and a resident who has pneumonia. Which of the following is an infection prevention example for link 3, portal of exit in the chain of infection? The sick resident should cover his nose and mouth when sneezing. Always. Sick resident always should cover his nose and mouth because you have a healthy resident with you and you don't want them to get sick. A resident is restrained due to doctor orders. Which of the following is true about a resident who is restrained? The resident is at higher risk of developing pressure ulcers. When they're restrained, they're at higher risk of developing pressure ulcers because they're sitting and they're restrained. A resident who has multiple sclerosis is prone to fall. Which of the following is one way that a nursing assistant can help prevent the resident from falling? The nursing assistant should leave the resident in bed in its lowest position when finished with care. Which of the following is a proper guideline for the nurse assistant to follow when there's a fire? The nurse assistant should use wet towels to block the doorways to prevent smoke from entering the room. A resident suddenly starts slurring her words. What could they indicate about her condition? She is having a stroke. Always remember when they start slurring, that is most likely they're having a stroke. A new resident needs to be weighed once he is admitted. Which of the following should the nurse assistant do when obtaining a resident's weight? The nurse assistant should always start with the scale balanced at 0. Very important. Always start at 0. And that it will be a question on one of y'all's tests too. Which of the following statement is true of admitting new residents to long-term facility? The nurse assistant should expect that residents will be expecting many losses and emotions due to the change. Very important. When admitting new resident, Some people come from a big old house, big family, but had to end up going to a nursing home or long-term care facility, and it's just very sad sometimes. And their emotions come to play. You have to show them empathy. Okay, y'all. These are all the questions for today. Thank you guys for watching. Everybody have a blessed day.